Order. Call this meeting to order. Roll call, please.
Ann? Here. Don?
Here.
Grant?
Here.
Jim?
Here.
Mike?
Here.
Pam? Here. Rod?
Present.
Toby?
Here. All right. Please stand and we'll. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, board, I need a motion for approval of the agenda. I second it. It's been made and seconded to approve the agenda. All in favor, signify by saying aye. Aye. And is approved. Citizen comment. We have, no one here that would like to talk to us, and we have anything written received?
No.
Okay, moving on. We need a motion to approve the minutes from January 18th meeting. I make a motion. Motion's been made, second by Ann, to approve those minutes. All in favor, signify by saying aye.
I want to raise a point of order before we did that. I'm not sure that if there, it seems to me there's a little discrepancy in the minutes from what was presented and what is written. And Mr. Chavez, I don't think he was upset with the board decision. He was upset with the process, and I don't know if that's important or not. Does that make sense?
If you want, we can, we've got it, if we can get the second call, we can certainly have you address that. Would you like to?
That's basically all I wanted to address, so I can.
Okay, so I guess we have the correction, so we can now move forward with the vote. If you're good with that, all in favor of approving the minutes as corrected, signify by saying aye. Aye. All right. Move right into departmental reports. Start with the end.
Good afternoon. These are numbers that we always kind of present here. Nothing out of the ordinary, another good month. We're having a lot of movement at the animal shelter recently, and yesterday we got one of our longest house dogs adopted. So he'd been there since June, so we were all very happy for him. But if you have any questions, I can go over anything over the specific numbers here.
Have any questions after reviewing the report? Seeing none? Thank you. Thank you. All right, next week, community health.
Good afternoon, my name is Mackenzie. I'm the community health supervisor. Before giving community health updates, we have a new community health manager, Tanner Dempsey. So I was just going to give him a minute to introduce himself to you guys.
Good afternoon, everyone. My name is Tanner Dempsey. She said I'm the new community health manager. I have a background in behavioral health. I've been working in administration in that capacity for about 8 years and in management. So that's kind of what I bring to the table here. If you guys have any questions, I'd be happy to answer.
Questions, anyone? Welcome aboard.
Thank you very much.
Thank you.
All right, I have just a few highlights for each of our programs. For WIC, you can see numbers are remaining steady. They're having still good participation. WIC has 2 dietetic interns. Each will be serving a 2-week rotation with the WIC department, one in February, one in March. So it's nice that we can give back to learning upcoming dietitians like that. March is also National Nutrition Month, with March 13th being our Dietetics Day. So special thank you to all of that team as well as our dietitians. I know they do such a great job giving back to our community. For home visiting, similar to WIC participation caseloads, they remain high. We also have no wait list, so really a perfect place to be. Full caseloads and no wait list, meaning that we're really meeting the demand and appropriately getting families enrolled. The home visiting team has been focusing on outreach and thank yous to community partners throughout February. So this is really their way to build connections with those that we receive referrals from for kids in our program, as well as partners that we refer kids to for services. They've done a really good job building that partnership and network. They're also working on refining some of their group connection process. Group connection is part of the program where families come together, so that they can connect with each other, and then there's typically, some sort of educational topic addressed as well. The program needs to do 9 to 12 a year, so typically about 1 a month. In addition to some of our routine ones like Christmas with Santa and some of those bigger ones, the home visiting team wants to do something that they're branding called Play and Learn. So using a routine location like the library or the park where families would meet about once a month, or when there's not another group connection like the Santa photos. They are hoping that this more routine meeting place will help build familiarity with families and make them more likely to engage. For immunizations, we will begin offering online appointment scheduling March 1st, kind of stepping into the new age of offering additional ways for people to schedule appointments. We also have MSU nursing students with us February through April, so lots of students kind of circulating around community health. We have hired a nurse that will be working that lead grant that I've talked about at the last 2 boards, so we're excited to have her join us. We did 8 additional Head Start lead screenings today, actually. One of those 8 kids did come back a little elevated, so we'll follow that kid and make sure they are receiving a blood lead screening to see if they truly have an elevated lead. For our maternal child health program, our nurses went to Only Bissell School and did scoliosis screenings for those middle school aged kids. They screened 35 kids and 3 of them came back positive or requiring referrals to get follow-up with primary care. That's all I have for my programs. Does anyone have any questions?
Can you clarify the MSU nursing students, do they come in, is it like an apprenticeship or is it like a lab for them?
Yeah,
How does
so-
that work?
So it's part of their curriculum. So public health is a semester of nursing school. It's one of the classes that they take. Right now, we actually have 2 different types of nursing classes with us as MSU is phasing out an old curriculum and introducing a new one. So the new curriculum students, what we'll see going forward, are students that each spend 1 day with us and they just rotate through clinic. They're able to practice their skills like giving shots and blood draws. The kind of phasing out public health students, this is the last semester we'll have them. And it's 2 students that are assigned to us all semester and they do kind of project-based learning in addition to clinical. So the project we have them working on right now is prenatal care education for early pregnancy.
Okay, so they'll be doing that for almost 2 months then.
Yeah, yep. Kind of the spring semester.
Thank you.
Yeah.
I have a question.
Yeah.
Is there any, I see your influenza immunizations are down to like 36 in January. And you push it obviously in fall.
Mhm.
Is there any, and typically, I think influenza immunization programs go through, at least through the peak of the season, and I'm not sure from the numbers that'll be presented later, whether we're there yet or not. Is there any thing that you do that promotes or continues to suggest and recommend immunizations even after that original peak that you get in October, or? is it just kind of-
Yeah, I mean, in general, so when people come to our clinic for immunizations, we're usually looking at anything they're eligible for. So even if they're coming in for, school or work or for another travel immunization, we will typically look at that and offer an annual flu vaccine.
But community-wise, nothing is particular.
Not massively. We've done a little bit of outreach. We went to the warming center and offered immunizations there, towards the end of December. Really, the peak demand is that October, November, kind of September through November. And most people that are super interested get it during that time. And then we just continue to offer it in clinic.
I just wondered if there was any secondary thing.
Yeah, we don't see a huge demand, so it'd be tough to go do an outreach, I think. Any other questions?
Anyone further? No, thank you very much.
Thank you.
Next is population health.
Good afternoon. And starting off with influenza, since we're on that topic a little bit. As of last week, we did surpass the total number of flu cases reported for the previous 6 seasons. So beginning with the 2017-2018 season. So far as last week goes, we've had almost 1,600 cases reported this season compared to our previous high, which was from the 2017-18 season, which was about 1,500 cases reported that season. So we have another 16 weeks of surveillance that we have left for this flu season, so we'll just kind of see where the trend continues to go and we'll see ourselves in the next couple of months. As you can see from the reports, January was a pretty busy month when it came to flu. We had quite a few influenza-related hospitalizations and some deaths that were reported to us. I did add some age demographic information pertaining to the hospitalized flu on there. And as well as, just the vaccine status breakout. So on there, you can see that about 73% of those hospitalized did not receive an influenza vaccine, and about 23%, or 72% did not receive a flu vaccine, and 23% did. So clearly indication that flu vaccines are an important protector. And then about 63% of the hospitalized were in those of ages 65 years and older. And I know last month there were some questions about some of the influenza-related outbreaks that we had in congregate care, and any hospitalizations that might have come from that. We really didn't have too many hospitalizations that came from those outbreaks, and I would say maybe just a couple. And then some of the outliers that we have on the communicable disease report, we did have a couple of dengue cases, travel related, of course. And those were both related, same travel exposures. One was a probable case, because they did go in for evaluation and testing, and the other one was just an EpiLink case because that individual did not go in for testing, but we EpiLinked them to the other person because same exposures, same symptoms and whatnot. And we did have an HIV case, and that individual was investigated and follow-up care received on that one. And then lastly, the Legionella case, that one was also related to travel. They became symptomatic before they returned back to Flathead County. So any other questions or any questions on the communicable disease report?
The latent TB cases, are those 5 new ones?
Yeah.
Was there any, do you know where they came from, how they came about to be detected?
Yeah, so most of them are occupational related evaluations that are done prior to somebody starting a job. And a good portion of them were individuals born from other countries that imported here and established occupation here. Yeah, good question.
Any further questions? Seeing none, thank you. Family plan.
Good afternoon. So family planning numbers are staying steady. We had a little bit of a dip in January for unduplicated visits. We have 2 more months to meet that goal. I'm not sure we're gonna make it. We have to average 120 unduplicated patients for February and March. And we only reached 120 one time in the past 10 months. So we're gonna be cutting it pretty close to reach that deliverable, which means we won't receive all of our grant funding. They pay us per unduplicated patients, so we might fall a little bit short, but you never know. We've been doing our darndest doing outreach to try to get folks into the clinic. As you can see, the month of January, we reached almost 1,000 individuals. Our health educator went to a lot of local schools and community agencies and provided education on services, STI prevention, and pregnancy prevention. So we did a really good job last month, really busy. Narcan distribution remains pretty high, 150 in January, so giving those to individuals and businesses who might see higher risk individuals. And our syringe exchange collection and distribution is staying pretty average. Any questions?
Yes, I have one.
Yes, sir.
I'm sorry, I'm not aware of it, but, do you know what the shelf life of the Narcan you distribute is?
I would have to look, but I think they're at least a year or 2 out.
Okay, because I wonder, as this is gonna be an ongoing program, if you advise people that you do distribute it to make sure that they know when it expires and come back for a replacement.
Yes, sir, yeah.
Are we tracking how many Narcan is actually, how much of it is actually being used? out there? Are people coming in for replacements?
We track it, so during syringe exchange or harm reduction program, when folks come in to access services, we do ask them if they've used Narcan since we last visited with them, and we track that in a system. But we don't track what we're giving out in the community unless they came back and let us know. So we don't have a mechanism right now in place that would track that.
Do you have an idea from the follow-up that you do, how much of it's being used, or not percentage-wise, but?
I could get you information next board meeting. I could chat with the gal who does it and see what reports we could pull for you.
Just curious.
Yeah, well, I'm happy to.
That was a good question.
And one follow-up on that too, please. Is the Narcan we're getting, is that part of a federal program?
Yep, we receive federal funding for Narcan distribution in our region, which covers, I think, 6 to 8 counties. So we do it all the way to Missoula, Libby, Lincoln. So we're covering a very large part of Montana.
And as part of that granting, they're not asking for follow-up?
They ask for how many we distributed, but they aren't, and they ask how many times people let us know that they're doing it, using it, but they don't have a specific mechanism in place either to track that.
Okay, interesting, thank you.
Yeah, good points.
How long has this program been in existence?
Which one?
The Narcan?
We received that grant, that became last September, last August 2023. So not long. Which you can see the numbers change drastically when we receive that grant money.
Further questions?
There is a mechanism that they try to, and I might know a little bit more about it, but where they would try to track overdoses and what was done within the sheriff's department. And we've talked to them, it's just, they just don't have the staff to be able to track that kind of opioid overdose type of stuff. So I know that it's being talked about. It's just the state hasn't given anybody true guidance on how the best way to make that happen in the communities. So, but it is being talked about of how to track it.
Well, you know, we all like to do that.
Yeah, everybody likes it. Yeah.
Well, and I want to add a real life, because I have a friend whose son overdosed and somebody had Narcan and it saved his life. And that was just within the last 3 months here. And if he wouldn't have had it, he would have died. And he's not a bad kid either.
No, I think a lot of people think it's just specifically for people who are using drugs, but if you think about your elderly grandmother might have painkillers and take too many, or your kid gets into the medicine cabinet and takes something they're not supposed to. So I'm just really recommending that everyone has Narcan on hand and learns how to use it just like CPR. And we provide Narcan training during all of our CPR training too now, so folks have that education.
Very good.
Thank you.
Anyone further?
Thank you.
All right. Help.
Good afternoon, I'm Jim Wardensky with Environmental Health. I guess the first thing that I'll mention is we've had an increased number of requests to consider incinerator toilets as an alternative wastewater treatment mechanism. And so there's been a lot of conversation between our office and DEQ and other environmental health offices throughout the state. Currently, what we're waiting on is some guidance from DEQ. We learned here this past week that DEQ is being sued right now over air quality issues related to greenhouse gases. Scenario over in Laurel, I guess, that they're dealing with. So they're being extra diligent regarding the emissions from these incinerator toilets. So really, the 3 primary considerations that we have in our office were the emissions, not only from what's exhausted out the stack as the waste is being incinerated, but also the emissions from the propane that's being burned. And then how they're gonna effectively dispose of the ash that comes from these. if it's considered hazardous waste and all of that, so there's some regulations in 40 CFR and then also through the Montana Code Annotated that dictate that, so we're looking into that. And then lastly, our septic regulations on new construction require some sort of backup, so if it's an alternative drain field location or something, so that way if the incinerator goes down, do the people have to vacate the premise, or, how are we gonna deal with that? So we're talking about requiring additional tank space, so that way it would allow the homeowner to utilize the tank space while a repair is being conducted or a replacement for the system. And then hopefully they can get it pumped in the interim, so that'll buy them some time to make that happen. So just, again, working through the process, and we have a couple of people that are anxiously awaiting an answer, so we'll get that, figured out as quick as we can. From an air quality standpoint, I think I previously mentioned one of the things that we were trying to combat with that is our air quality regulations were last updated in 1996. So they desperately need to be addressed. One of the things that, question that I posed to the state DEQ was, can we use the air quality funds that we receive in the grant to outsource the rewrite of those regulations? And that's been probably 5 months that I've been waiting for, with multiple inquiries to say, can we get an answer? So just within the last 2 weeks, they reached out and said, yes, absolutely. But they cautioned me, they said, please make sure that you communicate with us because it's part of a SIP. Apparently Missoula County did not do that. They went through and rewrote the regulations, implemented them, didn't communicate with the state, and then they had to go back and redo it all because there were things that didn't jive with the SIP with the state. So we'll make sure that we do it the right way. New hires, we just had an interview this morning for the second seasonal mosquito control technician, and we're hoping we've conducted 2 interviews now, so fingers crossed, both of them will come on board and that'll get us fully staffed there. One of the things historically that's been problematic with those positions is usually people are looking for permanent employment, not just seasonal. So frequently what happens is they'll start the season and then somewhere before the season concludes, they find another job and leave. So that's something that Brock and I are continually talking about and evaluating on how we can deal with that. The other potential new hire is our sanitarian position. And we interviewed, I think it was on Monday, for that position. We've made an conditional offer of employment to a young lady who currently works at the plat room. She's accepted it, and so just a couple of steps in between her coming on board on March 4th, I guess. So I wanted to give a special thanks to the health officer and deputy health officer for making that happen. I know that they had to, look at some budgetary things and all of that, so thank you for that. It'd be a great addition to our staff, so. Groundwater monitoring is coming up here shortly. Actually it could start happening about any time depending on the weather. We have a limited amount of applications in so far, less than what we've historically seen. But I guess we'll see how that goes. One of the concerns that we have there is because of the lack of precipitation that we're seeing so far. with snowfall and rain and all that. One of the things that we're talking about is, in the regulations, it talks about if the precipitation in any given basin, is 25% below kind of drought conditions, it could prompt a conversation about invalidating groundwater monitoring in that specific drainage or basin. So what we've done is with each of the applicants that come in, we alert them to that and let them know that it's kind of a swim at your own risk type of thing right now. We won't be able to make that call until later in the season. We're also, we've developed, an email that we're gonna send out to all the engineers and consultants and everything to alert them to that as well. So that way, if they're communicating with clients or potential clients, you know, they can make them aware of that, so.
Jim, can I just interrupt that?
Yes, sir.
If in that circumstance, do you, if it's 25% below drought level in that basin, do you not approve or do you conditionally approve? Based upon what your groundwater thing shows?
Yeah, so there's an algorithm that, there's a lot of things that go into this. What I offered is a oversimplification with just the percentage, but there are a lot of things that go into it. And, you know, if it ends up where, based on the equation, the results of that equation, that it shows that, you know, the results aren't gonna be accurate, then they would be invalidated, you know, so, unfortunately, that would likely prompt somebody to remonitor, you know, the following year again, you know, so, I'm fingers crossed. I don't want that headache. I don't want to have to make that call, so, you know, do a snow dance or whatever you got, work some magic for us, please, because, you know, hopefully, you know, a lot of projects are pending and waiting on that stuff, so. The last thing that I'll mention is, last meeting, we had the appeal, the Chippers appeal, and, I fully anticipated seeing a variance application, and we didn't receive one. I brought it up in our Wednesday meeting, and, I was told that they submitted an application to re-groundwater monitor, so they're gonna try and go that route. As opposed to filing or, applying for a variance, so. Wish them luck, you know, I hope it works out and, you know, would, help their process there, so. Just wanted to give an update on that, so.
Are they doing that, remonitoring this spring?
Yes. Yeah, so. Yeah. That's all I have unless you have questions.
Do we have any incinerator systems in the valley?
None in the valley. The last I heard, the most recent information I've heard is that DEQ has allowed 5 of them in the state. For whatever reason, they haven't given the overall approval for them. And to me, that seems a little crazy that you would allow them but not give an overall approval, and I guess, we're digging into that a little bit more too. You know, as I mentioned, I think before, you know, when we think of the state, you know, our state is very diverse in geography, topography, geology, water, and all that stuff. So, you know, some of those things, I think the last one that I heard of was in Park County. So, and I'm not so sure that one, I heard that the local sanitarian just wrote the permit and run it by anybody, so we'll see how that goes. And of course, we don't wanna cause ourselves any grief, as a result of that, so. So we're trying to thoroughly vet it, make sure that we're covered on all aspects, so we, mitigate any kind of potential liability for the county. I guess since I mentioned that too, I'll tell you that, as of last week, David Randall and I from the county attorney's office were working on that discovery stuff with the Herbert variance and appeal to DEQ. And we had to go through what they call stipulation of facts. So they provided us a document with, I think, almost 30 facts that we had to go through word by word, line by line, and either agree with or refute. Once I gave my rendition back to David, he was gonna have to, and of course, their attorneys submit that to us, late Thursday afternoon, and we have to have it returned by Friday, so, it's just games that people play. But we're doing our best to make sure that we maintain that timeline, so it doesn't slow the process down, or, doesn't garner any criticism on our behalf for not complying, so. Again, the end, result of that is, probably May, June timeframe that we should have some kind of guidance from DEQ on that, so.
Rob,
Thank you. I have a question about the incinerator toilets. So are they a regulated item? So my question is this, if somebody already has an approved septic on their land, can they install an incinerator toilet over and above a septic system? Or to help offset their septic usage?
Well, we've never permitted one in Flathead County, so I don't have an answer for you. Right now, the answer is no, I guess, because we haven't until we dig deeper into, what environmental impact they're gonna have.
So we don't know if it's a regulated,
Well,
if somebody's selling them, I guess that's my question. If somebody's selling them,
in some states, they are. Some states have given the approval, much like a specific septic tank, say, where based on the specifications of a certain septic tank, one of the things we've seen is an emergence of plastic septic tanks for a whole host of reasons. So, usually what happens is DEQ will evaluate it and make a determination, yes, it's okay, no, it's not okay. And if they say it's okay, then we look at it based on our regulations and, look at each application of it. There are some things that with the incinerator toilets, because they're all self-contained, with the exception of the emissions part of it and the ash. But as far as the wastewater goes, there's nothing that's going into the ground, so that creates a whole host of questions, well, do we treat it as a holding tank, or how do we address this, and how does it apply to the regulations? And cause once you allow one, it's hard to say no to any other ones, so. And then there are a number of different, they have an A series and a B series. The A series uses gray water, wastewater segregation and a drain field. The B series is all inclusive. It takes care of everything. Well, we can't allow the wastewater segregation for the A series one. It goes against our regulations, but the B series one doesn't need that. So again, we're somewhat of pioneer in a lot of these things, because as I talk with other jurisdictions throughout the state, they're not even seeing it, or you know, again, it's a little scary to me that they're just saying, yep, go ahead. And when I start asking questions about, have you considered this? Did you look at this? How do you know, justify this? They're like, oh, no, I didn't think about that. So, yeah,
Okay, thank you.
yeah,
Just from an education, one other question.
yeah.
Do air quality regulations vary from county to county throughout the state? Is there like a standard that the state sets and you can make them more stringent, or do you all have the same ones? So the regulations that you come up with, are they pretty much in every county of the state? Just from my education, I don't understand that.
Yeah, the state kind of sets the minimum, and then the counties can make it more stringent. So as an example, Missoula County a few years ago, I think probably some people are aware of this, they prohibited burning wood stoves in your residence, you know. And we're advocating for that. They have very strict air quality regulations there. And some of that is, you know, Lincoln County, just because of, the geography there, there's such a small little valley and they get inversions very bad. They really restrict a lot of air quality stuff too.
I had one question. Last meeting, we talked about the issue of these advanced new treatment systems and the DEQ's requirement for the 4 foot of separation. And we talked about, would that be something that can be put towards the DEQ to see if they can reevaluate that and come back with a change in their rules? Has there been any conversation at all concerning that?
Yes. And that was before, the Herbert appeal to them, in a meeting, and I think I shared this with a couple of people. I participated in a meeting, I think Toby was there, and up at DNRC, and Sean Rowland, who's, you know, part of DEQ, he's in charge of their subdivision, review division, and senior sanitarian. And I asked him, because we were in the early stages of this, and naively, I thought, well, you know, if we could just get the number changed, that would resolve everything. And I asked him, I said, is there any appetite at the state level, Sean, to reconsider the 48-inch threshold? Said, you know, other states, some of the documents that I've provided to you guys, like Colorado, has a 48-inch threshold. However, if you can engineer a system that combats some of the things like virus attenuation and, you know, the non-degradation stuff with phosphorus, it could be lessened. And he explained to me, he said, well, Jim, he said, all of my career, he said, there are some things that are golden rules, quote unquote. He said, 2 examples that I'll give to you is 100-foot well radius, you know, from a drain field, and then the 48-inch rule as far as separation to limiting layers. And he said, I'm not completely opposed to it, but he said, you'll be hard pressed to get that changed.
So one of the things we talked about was is from natural ground level, as compared to an engineered system, that we can actually get the 4 foot of separation using a different media, and a different type of system. And, so I guess they can keep their 48 if they would just allow, instead of having natural ground, natural soil system and building. Is that something that has even been talked about, or?
Well, in some of that information that I provided to you guys, one of the things that it talks about is the reason that you need natural soil is that sand in and of itself doesn't provide the same level of treatment as natural soil does. You know, so if there was a different soil composition, you know, and I talked with August about this a little bit, And, so, you know, if there's a different soil mixture that can be, constructed in a sand mound, then maybe that's something that would work, you know, I mean, you'd have to look at the science of it. But artist said, yeah, well, you know, the problem is once you start leaning more towards clay, that, you know, really does a good job with phosphorus. It slows the percolation down to the point where the system doesn't work. You know, so, you know, again, I'm sure there's somebody that's gonna find a solution to this, because there's definitely a need for it. You know, you know, Mr. Trevino and I talked about this a little bit in a meeting we had. And, you know, one of the things that we talked about is, you know, there are some ingenious people out there, that, you know, should be looking at that stuff. I don't believe that that's our role to go out and look for new technology, or, you know, doing experiments and all that stuff. You know, I don't think the taxpayer should have to pay for that. You know, if an engineer or an inventor or entrepreneur wants to look into that stuff and create it and then bring it to us for evaluation, perfect.
Some of them have. I mean, with those advanced systems they've got now, not just the level 2, but there's the other one that's even more advanced, correct? That does even more to our septic before we treat it.
Yeah, again, one of the things that I would caution is that, you know, and Mr. Buxton talked about this in that last meeting where he said, oh, well, this is way better, this is way better. Well, regarding nitrates, it's better, nitrogen, it's better. But again, it doesn't address, and the reason that, you know, that natural soil, 48 inches of natural soil, you know, they don't have to worry about it with the non-degradation analysis because they say, oh, well, you know, it's already addressed with level 2. Well, it's not. Where it gets addressed is when it filters through the natural soil. And that's where some of those things occur, you know, so, level 2 is great, you know, for its purpose. You know, so, you know, again, it's, you have to look at all aspects of it.
Now, I just hope that DEQ keeps their ear to the ground and actually considers some of this stuff as these folks are bringing different modes of treatment forward, you know, I don't know.
I agree.
What we can do really is a forward, but encourage that.
Well, what Jim is saying, and I think, you know, after we met and I read through all the stuff that you sent, it does look like the 48 inches is a sacred number. That, you know, we're gonna only get that removed by some sort of exorcism, and it's probably even gonna come from county commissioners, but. So, and I think that the other thing in the soil reports that you sent me, I think was it Wisconsin or Nebraska or wherever, you can engineer the soil. They actually have already engineered it 50%, you know, sand, 24% organic materials and so much clay, and then materials of a certain size to get that 5 inches or 60 inches per hour, whatever that rate is. So that has been done and it is there. And I think if there's any one place that we could poke the frog, maybe is an engineered soil, but as Jim said, and I have much more respect for all you guys' department, what you guys are trying to do, it would have to come engineered and tested, because even the state says, there's a portion in the state, that documents that I read, that you can come with new technology, but you have to have all the science to back it up, because they don't have that ability to do that. And I see where we're being kind of pounded on first, like that game at the carnival where the little mole sticks its head up and you hit it with a, you know, wooden mallet. I think that's kind of us sometimes. But, I think that, yeah, it can be, and that would be a place that we would, if we could push, would be in the engineered soil, or that with the advanced systems, which would give you the ability, because the bacteria and the viruses break down in an anaerobic or aerobic environment, and they break down within a foot or so, where phosphorus breaks down, 4 feet, and some of the other material doesn't break down at all. So the bacteria and the viruses, I know that was an issue that you addressed before, that the new systems don't, and it didn't look like, but if the soil is compatible, it's breaking down now anyway, as soon as it reaches into, and it's funny that as you read this, the anaerobic process the breaking down of the phosphorus actually creates global warming. That's according to the statement. So we're replacing one negative with another, we're actually warming the environment by this anaerobic process. So Jim's got some good documents. If any of you are interested in getting some sleeping material, you won't have to take melatonin on a Friday night, but no, good stuff. Thank you, Jim. I appreciate it. But yeah, I think we could engineer, if I were to do it, I'd get on the engineered soil. Because it looks like you could absolutely do it and do a really good job of this and get all that material out of there.
Well, good. Thanks for the info, guys. Thanks for the work, Jim.
Yeah.
Finance?
Good afternoon. I'm Kirk Zander, I come for the health department. This is the January report, and I hate to say, everything looks good. Revenues, expenses, cash, all right in the right spots, so I don't have anything else to add. Any questions on the financials?
Folks?
No, well, I will add, I have gone over the numbers with Kurt and excellent numbers, excellent, by the way. And keeping track of everything, you guys couldn't be better off with somebody with impeccable credentials to keep track of the finances and, to make sure this stuff. So I'm on the finance committee, I feel really, really good about where you guys are and where you're going. So good job.
Thank you.
I'm just curious, it looked like the immunization revenues were higher, much higher than had been budgeted. Is that something that's anticipated to continue going forward?
It is, before we were subsidized, on our COVID vaccinations. And now that we're not, so we're now billing for that revenue. And then, of course, we got the associated cost with the vaccinations themselves. And, also this year that contributed to that, a lot of RSV, that we never did have previous from last year. So depending on how RSV looks and COVID looks, and those revenues and expenses will probably maintain at that level going forward.
And then in environmental health, it looked like you were in a deficit. And you're adding newer people. Is there any, I guess, balancing of that in the future so that you don't run that deficit or any way to increase that revenue?
Yeah, and looking so far this year, their environmental health is down a little bit, but it's pretty comparable to the previous year. And one of the things you're not seeing in, this is a cash report. This isn't an accrual based, this is based on cash. So one of the things we've got is we've got the second quarter health inspection payment that's coming up. That's not reflected in here yet, and that will be probably $40,000 when that hits. And so that will add to that revenue number that you see there. But overall, yes, we looked at the efficiency of, how much work I imagine needs to be taken care of, and volumes. If volumes start dropping off, I'm sure that will have to be looked at. But I know Jim's busy, so.
Any further questions? Seeing none, thank you. Health officers.
I don't have too much to add to everybody. They all do such a good job that it kind of takes away anything I have to say. But I do want to say thank you to David Randall. I know he's not here today, but he's our county attorney. He hasn't just been helping with environmental, which has, taken up an extraordinary amount of time, but he's also been helping with our communicable disease, some things happening in that world, and also with our animal shelter. And David is always responsive, and we couldn't do it without him because he kind of keeps us in line, so to speak. So I do want to thank him for that. I know that a few of you have inquired about the septic or the septic treatment plan, and I did talk to Whitney today, and she's the one that's primarily working with it. So it is currently kind of working within the attorneys. David Randall is one of them that's working it with Lakeside Summers District. So I think the Lakeside has the agreement with their attorneys right now. And I know that Whitney said the goal was to have it to their board of directors on the 20th, and then potentially slated to meet with the commissioners on the 22nd. So hopefully they can get those agreements going and, that would be the, path that they take if everything is, worked out between those. I know Toby has it.
For clarification, then, not doing, you're just gonna, the septic's gonna be hauled there and treated through lakeside.
Yeah, so the money that we had allocated for that, the one that had made all of the news and everything, that money would be allocated towards Lakeside for their for an additional, they're already doing an expansion that they already have planned, and then we would add to that additional expansion to be able to take that extra septage.
And would they be using, the road that, came through the ground that the county purchased for that? Or would they move somewhere else? So in other words, we'd be leaving those people alone that were upset about us wanting to put that there.
I don't know, the county owns that property.
Right.
So I don't know what the county has planned for that.
Yeah, it's still up in the air a little bit, and as far as where it will be built, where Lakeside's gonna put it, it would be on their property. Where they're doing their expansion. So what will happen with the Dyer property is still kind of up in the air. Working through the details, it could potentially be that the Lakeside would end up with that property too for any future expansion. Nothing to do with what's going on now, but maybe future expansion for them. So.
Good, I'm glad it's moving forward.
Yeah, moving forward. And then we were moving, Kirk didn't necessarily allude to it, but we will be, moving into our budget period here. So, that's when we're gonna really start to crunch the numbers with Kirk and Keelani and everybody, just to kind of look at everything, but that'll be coming up. It's coming up fast and furious. So that'll be taking up a bulk of everybody's time, so.
Anything further? You have any questions for? No, and seeing them, we have no committee reports. Board member discussion. Would like to start a discussion on anything.
Sure. DEQ through their subdivision program has gone through about a year-long process of rule revisions. I think they just accepted kind of phase one on some of the, I guess, step one revisions. A lot of it has to do with septic systems, DEQ4 and stuff. So I'd like to see the county kind of look at adopting a lot of those revisions. A lot of it was pretty common sense stuff that needed to be fixed for many, many years. We're working on non-dag rule revisions too now, kind of cleaning that up, making that more simplified and easier to understand. So just keep an eye on that and kind of align our regulations with those as best we can in the future.
On further? No, all good. May I have a,
I move to adjourn.
Nate, all in favor, signify by saying aye.
Aye.